Okay, so hello and welcome to another episode of the PASA podcast, where conversations meet the world of health, healing, and students' life. I'm your host today. My name is Jessica Nanowu, so you can call me Jess Padilla. And today we'll be delving into something very special today, from the roller coaster of first year experiences to the powerful fields of physiotherapy, exercise and sports science, and then sports management. Meet my guests here today.
Amarachi, and I'm a third year exercise and sports therapy student.
And then we have
I'm Derek AJ Apia. You can call me Capello. You can call me the man in black. First year physiotherapy student, but sports management student in the future.
I'm the person of Agule Sukin, a third year physiotherapy student.
Okay, so now we've heard who our guests are. They mentioned their names and then their years. So I will start with Amarachi here. Amarachi, so what was your biggest fear before coming to KNUST? And you guys should know she's a Nigerian, so
Hi guys, yeah, you can call me Amy too. For those of you that can't pronounce Amarachi, my biggest fear when coming to KNSC, I don't think I had a fear. I really don't think I had fear coming to KNSC. It wasn't my choice. It was more of anger instead of fear. Like this is
anger.
not where I wanted to be fair. So it was more like, yeah. Then coming to PASAP, I've always wanted physiotherapy. It was actually my choice to come to physiotherapy and sports science. So yeah, it was not a thing of fear. It was what I wanted to do, but not just in the school I wanted. But do I regret it now? No. I actually like the fact that I'm in Kenya to PASAP.
In Ghana too, yes.
Exactly.
Yes, please. What was your
Mm,
biggest fear before
my
coming?
biggest fear. My biggest fear.
You are in first year, so
Yeah.
probably you had some thoughts or you knew what you were
You
coming
wanted.
for.
Yeah, I knew what I wanted. But
You didn't
my
have
biggest fear was the fact that sports management wasn't separated from physiotherapy.
sports management.
Wasn't separated from physiotherapy.
That was your problem.
Yes, that I had to learn all those health things, the other health
So
courses.
now what are you aiming for?
What am I aiming for?
Yeah,
For sports management to be a department on its own.
Okay, so do you want to
Yeah.
do sports management?
Yeah, 100%.
Oh, interesting.
Really
1000%.
Yes, Kim.
Well, my fear would have been academic performance. I am someone who, back at home, my parents see me to be an intellect. So if I come and I do not perform well, it will be very, very bad. So when I came, it was something that was worrying me. So when I got to know that the first class is 70, I said, okay, I can do that. And so far, so good. I am surviving.
Yeah,
Shako.
all right, all right. That being said, okay, so I would want to ask, what was one thing that you wish you knew before entering this particular department?
one thing I wish I knew. It's not as easy, I think, as people make it seem. Like it's also not that hard, but at the same time, it's not an easy, smooth run because, as King said, the fear of academic thing. Me, I won't say I had that fear, but just a thing of since I wanted to do this, I have to make the best out of it. And then seeing the courses, seeing the people, like okay, it's quite calm, like easy breathing. But then in first year, first semester, there,
In fact, the timetable alone is
life
something.
will show you that okay, yeah, you have to actually sit down and read and study hard and everything too.
Yes.
For me, it's not easy. That's what I can say.
So
I wish I
one
knew
thing
that.
you wish you knew wasn't that.
Like, wasn't that easy. Yeah.
Agules, please, you second.
Oh yeah, what they are saying is true, and what they used to tell us back at SHS, they should stop saying it. It's a lie. University is
It's
never
like
easy.
they say, oh, you come to university, you
You
have
have
the
a
best
lot
time, or
of-
you can do whatever. You don't
You
have
can do
even when
whatever
I
you
finish
like.
anatomy by 7 p.m.
Thank
There's
you.
no time.
Come to
There's
class
no
6
time.
a.m.
Come start 6 a.m. for accounts, you finish 7 p.m. You go back, no time to rest. You have to study, do assignments.
That is very
Those
true.
positions.
And I realized, you see, when it comes to our department and the way our timetable is structured, ours is not flexible at all.
Thank you.
Really not.
You go
And-
for clinicals and you come back
You
for
come back
lecture.
and then you're having 8 a.m. the next day to finish at 7 before you get back to hostel like
Even
8
the classes
p.m.
that have been fixed after clinicals is what I don't understand. But all being said, final year is not also easy. I'm
Nah.
telling you the truth, because you don't even have a day you have to take your data or something. You are going for clinicals twice in a week. You have 8 a.m. classes. You have classes in the evening, and you see most people are dealing with probably students and even patients.
Patient.
And then you know that the physiotherapy departments they close at 2. So what time will you even close class and say you are going
You're
to the
going down.
hospital to even take your data? Saturdays and Sundays too, they
You
don't
Still
work.
don't work.
So final year is also like, I feel it's like the first year replica. Because you see the way first year the timetable is really packed.
That part.
That is the same thing that happens to final years, and it's really really bad. And I'm just hoping probably those who be coming, you guys,
It will be better for because first year
if you
was
can
like,
actually push for a day for your
for
research.
maybe a free day to maybe meet your supervisor, do your research. Because
There's
I know for
nothing
some
like,
departments, I think their Fridays are what's off. They can go and meet their supervisors for their supervisors to speak to them, go and collect their data. So I think we can actually push
we
for
don't
that.
have that, but you guys should really try and push for that,
Yeah,
or else
we'll
you'll be
push.
through that same problem.
We'll
All right.
push.
So how was your experience? How would you rate your whole first year experience, or how would you brief it?
Uh, first year experience. Ah, I say it was okay. So far, so good. It went well. Just that the timetable allocation, how to get to campus, it was challenging, but some way, somehow, I survived.
Oh, you actually did survive. Yes, so far,
So
how has it
far,
been?
first semester, and all
How
I'm
has it
saying
been?
is it's not easy.
Hey, first year I saying is not
Eh,
easy.
First semester.
First
I'm
semester,
sure.
it's not
First year is not easy. All right, all right.
It's just not easy.
Yes, Amarachi.
I think for first year was actually okay as I going to say. I mean, I think for first year, first semester, it was very okay. And then by the time we entered second semester, then first semester results came out. We were actually in physiology class. I'll never forget that day.
Jesus.
And everybody stopped paying attention in class. And then we're like, Jesus Christ.
Oh,
Like,
God.
what happened? Because you wrote what you wrote was not showing on the aim app that okay, that is the grade. So like I think second semester was now more difficult with anatomy, with physiology, and then after seeing your first semester result, I like you actually do need to sit up or you actually do need to maintain this because anyway. But overall first year was actually it was good.
It was good.
Yeah, my
Yeah,
first
it
year was
was.
actually good.
Wow. We
I
are
won't
blessed.
complain.
I see,
We are
I
blessed.
see. So with that, most of okay, I would say for me, before coming into the university, I didn't really have anyone I would ask, oh, how is it like? So for my first year to prepare for all those things, do you get it? And then it's like you have other siblings that are looking up to you, so you know you have to make the best out of yourself, because there's no standard for you to say, oh, okay, this is the standard that is in the family, so let me just break that standard, do better. I
You
was
are the standard.
do you get it?
Yeah.
So it's like you are going to face any, if you make any mistake at this point, it means that the others will be affected, or probably they may be looking up to you, and then something will happen, and then you feel you fail, but
Failed.
them will be their standard. Do you get it? So it's like this pressure on you always. You have to be your best at every point in your life. So my first year was like I was now figuring out everything, like everything. It was like a whole pressure for me. But I feel along the line, everything became calmer. I understood what I wanted to do, everything that I had to go through, and then it became better.
Okay. I think me too for my first year too. Being an international student, obviously my fees are paid in dollars. So like I think that was also one of my greatest. I can't go home and tell my father that oh I trailed this course. I have to go back in
Come back
November.
here.
When I've gone home in August, paying the flight tickets, you still pay for the train paper. So it was like, nah, you actually do have to sit up. I thought being thinking of at home, you're regretting like, okay, should I have actually sent her here or not? So yeah.
My next question, I think I will direct it to you, because you are in first year. So what actually inspired you to choose physiotherapy, or what inspired you to add it to your courses?
Was it even part of the courses you picked? Like, was it part of your options or what they gave to you?
Yes,
Like, did they give it to you or you actually wanted it?
Oh, it was my first choice. My first
Really?
choice, yeah.
So you got your first
Yeah,
choice.
my first choice.
So you
Wow.
knew what you were coming
I
here
knew
for. So
what I
what
was
actually inspired you to put that test? Because most of me, I
I
put
think majority of
dentistry
us were
there.
people were put here. For me, I
Eh,
picked it.
okay.
But I think for the rest of my class,
The
Agules, you
medicine,
didn't
the
put that there.
pharmacy people.
Oh, I chose. It was my
Medicine.
third choice actually.
What
Oh.
was your
that's
favorite?
the first.
You didn't prepare to come to the department.
Well, my first choice was physician assistantship.
Oh.
The
Okay.
second one was veterinary. The
Medicine.
third being physio. The fourth one, I don't really remember. But I think I chose physio because my sister got injured one time, and the way they took care of her and she came back to full functionality, I was impressed. So I chose to do physio.
So
You
why
chose,
is
they
that
didn't give it to
impression
you.
didn't push you to put it at your first choice?
Exactly. They
Well,
give it to you, or then
You see, this is Africa, and once you are performing well, you like go and do science, you come back, everybody expecting you to have the title doctor.
Yes, yes,
So
yes.
I chose a physician assistantship because I would say my grade wasn't like I passed the cutoff for medicine. So the next best thing was a physician
That's nice.
assistantship. Then I chose veterinary too because if you watch these videos, how they take care of the dogs and things, so it was very, very beautiful. So then the physiotherapy because of my sister. So when I had it, I was even confused because when you look at how the name comes, physiotherapy and sports science. When I had the like I was accepted to come and read the program, looking at it, is this thing like PE? What would I tell my parents that I went to university there and study and come and become a PE teacher? And so I took my time to read and I saw that it's like three
It goes
divisions
beyond that.
here: physio, exercise therapy, and sports management. And I was like, oh, I'm safe.
Oh, okay. Okay, so please,
But
with your inspiration.
Yeah, I chose
how did you even know
physiotherapy.
about sports management? I think that should actually how did you
Yeah.
actually know about sports
I
management?
chose physiotherapy because I like the name.
Oh, gee.
Yes,
What's catchy about the name?
the name like physiotherapy. I just like the way the name
For
sounds.
you, I've never
Never.
heard this thing before
Oh.
in my life.
The first day doing
Physiotherapy.
orientation, I mean you were
Yeah, I think he said it during your
I told
introduction. So
you.
yeah, that was the name
You
that
You
we
Yeah.
just saw it and then you like
The
I
it.
name,
like
You know,
the
like-
name.
So you didn't have any background, any idea,
Oh.
anything
You didn't
like
know what you wanted.
what goes.
So you were looking for a course that sounded nice for
It
you
was
to teach.
very nice. I just had physiotherapy.
What we think when people mention physiotherapy is like massage people course.
Yeah.
You just said the name anyway, intrigued.
Of course, the
Interesting.
spirit's born of me.
Wow.
Like I just like the name.
And after you liking the name, now
Yeah.
it's made you like the
Yes.
Did you research on
department
it?
more, or it's like
Yeah.
just
From the name, then I went into it. What is it?
no?
So
Was
I-
it after you entered the university?
No. I researched on it.
Before you actually came
Yeah.
here. Oh.
So I
So
saw
was you
physiotherapy.
liking the name that pushed you to
Of
research?
course.
Okay.
Yeah.
So what did you find out about sports management when you entered the department or before you entered?
Before
Before you entered.
Yeah.
So you entered with the emotion of sports management.
sports management.
So what do you want to be?
What do
Actually?
I want? A sports manager.
See, nobody likes the department more.
More than him, I promise you.
Nobody.
When I go on my knees, I always pray for the orchestrators of this sports management.
Oh, that
Dr.
is-
FIFA, Sir Prince, those people. Oh, I always pray
Oh,
for them.
seriously?
Wow.
I
No,
didn't know someone had this much passion.
Oh, for
That's
sports.
that.
But actually, a lot of places actually do have passion more for sports management than the physiotherapy. They're all more
Yeah.
exercise, sports
Yeah,
management
exercise and
inclined than
sports.
they actually. Because when you ask for them, they came here for either EST or sports
Sports management.
management.
I think now the department is really getting the recognition that
And
it's actually
Yeah.
good. Yeah, so Agulis, what really inspired you?
Like I said.
Oh, with just your
Yeah.
list and then
What inspired me for physio? I feel like what inspired I first wanted to do physio because I can't work in a hospital. It was more like, okay, I can have my own private experiment. It was more like rehabilitation. I won't need to see the whole blood
Hospital
surgery.
settings.
Nah, I will cry with you. I will actually cry with you. So I can't actually just like, okay. Then when I entered into the department and then I heard about exercise and sport therapy, Manche actually stood strong on me. And I was like, okay, what is this actually about? And let me actually see. And on doing my research, I found out that I actually don't need to be on the field too. I can be like, tech girl behind the scenes, and like, okay, there are a lot of branches that is going to like biomechanics, kinesiology.
Okay.
And I actually prefer than actually being on field, being in
Field.
hospital, interacting with injuries firsthand and everything. And then dream job of working with like Nike, Adidas, as a biomechanics. Like, yeah.
Hey, where you get them? Please put
Oh yeah, and you heard it here first. When you see me there, like she said it, she worked with like
Nike,
Very nice
Adidas.
one.
Hey.
Oh, that's really nice. Like you see, when I see people having this much passion, even for their with their choices and afterwards, you see, before we came to the department, one thing is there's this whole misconception that physio is all about massage,
Oh,
and
thank
then
you.
everything. In fact, anytime, even among ourselves, the other departments, when people say physio, oh, baby, massage, I'm like,
yeah,
so
that's the first thing they think about when they hear it.
you see, so if someone comes to you with a fracture, is the first line of
Line
treatment
of-
going to be massage?
Of course,
I'm like, physio, we go beyond that. So I really like the fact that now people are having passion for it, and then they have other plans for it in the near future. So yeah, with my inspiration, me, I chose dentistry as my first choice.
I wasn't the
Okay.
only one.
As my first choice. And I also don't like this whole meeting injuries, blood, and all of that. That's why I didn't want to enter medicine as in full. But dentistry, it's kind of more of
Yeah,
I don't know how to, like superficial medicine. You get it?
But you
But-
definitely see blood.
but it will not be as
Small-
sophisticated
small-
and
small.
complex
Yeah.
as like when like
You see, being a
seeing
medical
broken
doctor,
bones,
Looking into
having
someone's
to
mouth
rush.
alone.
It's not.
Are you
see,
not
you
scared?
can
No.
go to the other. I mean, it's like that's what I was saying. Superficial
Superficial.
medicine.
Yeah.
You get it. It doesn't really go down much into detail. So, but then I got it with fee paying. I was like, nah, I didn't want to do dentistry and then do fee paying. I wanted to be a regular student. And then yes, physiotherapy was the next one. My Sunday school teacher was a physiotherapist. But then I was like, she doesn't go to the hospital. She has this, her building is much more of like, she has this, the upstairs is for her personal private sessions, and then downstairs that's where her family lives. I was like, oh, in physio you can just be at the comfort of your home and then still have private sessions, and then people will pay you an amount of money to really take care of them. I was like, oh, okay. I also want to divert to many things like being in politics and all of that. When you get to the political side, you realize that those people, they don't come back to the field to come and work.
Yeah.
They just work with the kind of posts they have. Like if I become Minister of Education and I'm a medical doctor, my duties will limit me from coming to the hospital. So I was like, okay, so if I want to branch into politics and all of that, then I can also be a therapist and also have my own private place where I'll do my therapy
I'm actually
sessions.
because of that minister of sports too. That was another thing that excited me. I was like, yes, minister of
I'm
sports.
gonna ask
But
one
no, I have
Let's
plans.
say,
I have plans.
Alright.
And being in the field is not part of it. I've always said that I can't be on the field. I can't be in the hospital, like the sun, everything.
you're
So
going to
my
politics.
preference will always be like behind the
Behind.
scenes. Yes, either coaching them, preparing, and
So you going to politics?
oh yes,
Oh,
you
yeah.
see me in politics. You see me.
Ghanaian politics.
No,
right?
please, Nigerian politics.
Yeah.
You see me,
Fine,
minister
fine.
you
of
are very
sports.
ungrateful. I cannot
Oh, I will come back. I never said I won't come back.
I'm sure.
I never said I won't come back.
Okay, so back to my next question. How do you think the physiotherapy and sports science as a whole will affect the National Sports Authority?
I think I'll speak based on my own field, exercise and sports therapy. I feel like gyms, sports clubs, and everything should have a strict rule of having exercise and sports therapists actually being on the field, because in as much as other health practitioners may know what to do, it's a thing of what we study. So like we know it more in depth than they would actually do and actually know how to handle it better. Because right now, example, the gym, anybody can be a gym instructor. Anybody's there. But like they actually don't know the dangers of majority of they don't even know like a lot of things you have to do, your posture and all those kind of things. I think like it's going to help to improve it a whole lot.
Okay, so back to you in your field, sports management. How do you think they can contribute to the National Sports Authority?
For sports management, I'll say a lot. I'll just
Already the
This one
Ghana
there.
football.
that is obvious. Obvious.
Okay.
Seeing it from the results of the senior team itself, the Black Stars, you can see she's talking about exercise and sports
Sports
therapy.
therapy.
She talked about just the gym. But even the football circles, the sporting team circles, they don't even have exercise and sports therapists.
Therapy.
Yes,
They
yes.
just pick anyone and tell the person
I
be
was
a
actually
fitness
going
coach.
to talk about that with the fact that I know it's actually ideal for a physiotherapist to also be part of
Part of the team.
but I feel the most required is the exercise
Exercise
and
sports
sports
therapy.
therapist
Exactly.
because they major into all clinical
Different.
exercises that they
Because
need.
majority of the things we see to are sports related.
Of
So
course.
a mechanism of a sports injury is different from a mechanism of a normal injury. Like if I twist my ankle as an athlete,
Yes.
it's different from the way you would twist your ankle and
Of
the impact
course.
it. So I will know more about it, and a physiotherapist may know about it.
Agunesu, what do you think?
Like you said, it's like physios kind of try to overshine the
I
EST
get it.
Oh
I
yeah,
get it.
definitely.
these sporting activities. But it won't be bad if a physio is around. But I think we should allow the sports therapist to focus more on the teams and the rest. But if the situation is too dire, then we come in, then help them, rehabilitate them. When they are ready to go back to play, we give them back to their exercise therapist.
For good training.
Yes.
Okay, so I'll leave you guys to
Do you,
say
by
something.
any chance, regret picking physio?
Me?
Yes.
Never.
Ooh.
Never. With the idea that you see, one thing that people don't know is that physiotherapy is like
It's broad too.
it's broad and
It's
it's a
very
skill.
It's
You
an
see the way you
everyday
go
thing.
to the ceramics and those who do architecture, that skill that they have to plan and do things. I feel we also have that skill. Ours
Yeah.
is not just you learning something and practically
Getting a job or
applying it in
something.
whatever you are
Yeah.
doing. Because if someone comes here, not let's put the theory up aside. Let's put it aside. If someone comes here probably with low back pain,
Yeah.
I do the necessary exercise. That is probably theory. I'm applying. Okay, do this, do this, do this. When it comes to the massage, you see, massage goes way beyond me just putting our hands like
Yes.
just doing something. You know the muscles you have to focus on. You know the thicker muscles and you know the thinner muscles. How you need to apply your pressure
You know the
so
different
that it
techniques that
doesn't
are needed
affect the
for each
person's
injury.
vertebra.
And
Do you get
yeah.
it? So I feel in as much as we are learning the theory aspect and then we are practicing it, I feel ours is like a skill. We have this special skill. That is why you see, even if the government does not employ you, you can do something
work on your own.
That's the big advantage.
That is
of
the
physiotherapy.
biggest advantage of it.
you can
like,
do
yes.
something on your own. And there's this one motto I've always been. In fact, anybody that asks me about physiotherapy, I tell the person that everybody needs a therapist. Or whether a child, even if you don't have any injury, probably you'll be stressed, you'll come back,
Oh yes.
everyone needs a therapist.
Even the way you would sit at work, the way you sit in your class, every little thing you do.
And you see, we really have that major advantage because the therapists in the system are not that many. And a lot of people are also traveling outside. Let's put that aside. We are not many. And if we want to actually make impact and then generate some income from it, I think we really have the opportunity aside the skill we have. And we working, even if we are not employed at the hospitals, we can even work on our own and generate income for ourselves. So people like anytime people are coming to the university, I be like, hey, have they heard of physiotherapy?
Yeah. But I think it's actually gaining numbers. I mean, for the first years, you can see the amount of them that gain.
100 and what.
And do people really know
actually are
physiotherapy and
now
sports science? It's not just you coming here. I'm not trying to shade any department like nursing or medlab. I met this one friend at Confanoch and I was asking her about medlab. So what do you actually do apart from interpreting something or bringing something, mixing things? So if you are not able to mix things, what do you have? Say, I have knowledge. The knowledge is up here. You see, that was where I really realized the fact that we don't just have the knowledge. Up here. We have the skill. So if you are coming here, you don't know whether the department that
will
they
help
put you
you,
whether
like,
it is going somewhere for you. Please, you better sit down. This is where you belong.
This is where you belong. Because actually, especially when prof teaches this class, not theoretically based, but practically decided. No matter where you find yourself, not just like you have the knowledge of it, you can actually do something
Do
with
it.
your
Yeah,
hands and like
like
know what you're
you
going
don't
to
just. I just want people to really understand. You don't just come here and then sit here learn anatomy,
Learn.
physiology, and then you
do.
finish.
Yeah,
I mean, you can learn your anatomy. If someone is coming, the gait is not doing this way. The muscles
you
are
know,
weak.
yeah.
You understand that okay, probably I have to improve the strength of the quadriceps or the hamstrings. Fine, it is good. But what goes beyond that? Someone with stroke, the person has come. What the person goes through to even gain that
Gain,
full
yes.
functionality.
Yeah.
I don't know whether people sit there
See there
to
to think
that
about
can't I also sit in the comfort of my home and also help my stroke guardian or stroke patient or
True.
family
Course.
member
To
get
climb back, or even a simple injury like your
so
brother twisted his
physiotherapists
ankle doing
people
football, like you
we
can
are not
easily
going to
help.
Wait for
prescribe
employment.
medications for you.
Of
We
course.
are there
There to do
and making sure you come back
what
to
they
your
do.
normal self.
Of course.
So
True.
all those misconceptions, I feel people are not really educated.
Yeah,
Enough.
people
They should
haven't
do
really
their
when they
research.
just think of physio, they just think straight
And I think
massage.
it's high time we make them know that now, let me say, diseases are moving from more like a pathogen based to a more chronic like stage.
Yes,
yes.
So
Yeah.
that one is based on your lifestyle and
And
other
everything.
things.
Yeah.
So
People don't need to.
that's where we come in.
Yes.
So if it's not based on these
Pathogens.
microbes and things,
Yeah.
then we physios are in there to help you. But if it is based on, let's say, sometimes let me say, the pathogens may cause the condition that will bring you to the physiotherapist,
Yes,
and we
yes.
work hand in hand. So they are like senior physiotherapists usually say, they're also autonomous like the doctors.
Yes.
So
yes,
it's
yes.
high time they are respected like doctors.
Sure.
But
Oh,
I
of
saw
course.
recently a woman
Of
that
course.
her knee, I can't remember what was wrong with it, and then they referred her to physiotherapist, and then she was complaining online like, oh, what will the physiotherapist do and all that, and then she ended up going, and then she now posted like she actually didn't know that physio had a lot of that. She actually just thought it was going to be massage, but she started bringing out suction tubes, started bringing out lead and all of that. She was like, so like there is more to physio and everything, and like it's a cause that people should actually look into. That it's not just based on you come, they rub balm on you,
Yeah.
and then they are massaging
I
your
sure
head.
the massage part is
Hey,
what
it's
kills
so
me.
annoying.
So if someone comes with stroke, we should massage
massage, like
them.
the first thing you just hear is, my back is paining me, a physiotherapist come and massage it
Come and
for
And
me.
even
massage.
with you guys, let me say, like on the field, someone just gets like an ankle sprain or something. You just do
We don't rush
you
it,
follow
just
the
that-
right
exactly
So people should actually learn more about
about
the
the whole
whole program itself because it has a lot of benefits. It has a lot of things that we can even offer, not just in our communities, but even at the national level.
Yeah.
Yeah, so I would like you to say something little about your choice. I mean, your
my choice of exercise and
yes,
sports
yes,
therapy.
Educational purpose.
Okay, so
anything you want to say. It could be an advice, it could be a caution, just anything you want to say.
okay, for exercise and sports therapy, I feel like it's a field that people should actually really look into because in first year, luckily, they organized a seminar where we have people to speak to us based on physiotherapy, sports management, and exercise. Because I think the year before that there was arguments of they weren't allowed to speak, so it's brought a lot of people not wanting the choices they made and not liking it. So it was like, okay, now let us give you people the chance to actually make that decision for yourself. So we're speaking to like we're talking about it a lot, like, oh, physiotherapy, this is what it entails, exercise and sport therapy, this is what it entails, sports management, and then everybody was still confused because obviously when you enter school, you can't tell your parents that, oh, you're doing exercise and sports. Especially when our clinicals were at the gym. So where are you going to clinicals? The gym. So it was more like, okay, is this really what I want to do? Where is it heading to? And but I'll forever thank Manchu because he was the one that really was hitting like every single step when I see Manchu, you're doing ESC. You're doing ESC. Like I did not have a choice. I actually went to that research on it to actually make the decision on my own. As I said, I don't like blood.
It goes beyond the gym.
It goes beyond. It goes way
And even
beyond
at
the gym. Like even at the gym,
beyond
there,
what you see carrying
What you see,
metals.
it's a whole lot.
Yeah.
That's why I didn't like blood. I don't like being in the hospital. I don't like anything that relates to that. So I was like, okay, exercise and sports therapy. But as of then, when I looked at it, I saw just the field out. And I was like, okay, on the field, in as much as injuries occur, you won't grade the severity the same way you grade it as when you're seeing it in the hospital. It's like something I could also like work with being on the field. Like it won't be like very, very bad in seeing blood in the hospital. But then for that studies, I saw kinesiology, I saw biomechanics, I looked into it, I was like, okay, I don't need to be under the sun. I don't need to be on the. I also don't need to interact with like blood and everything. I can be like at the back doing analytics and the rest of it. I'm like, okay, it's also giving a tech girl vibe, giving it in sports. You can work with shoes.
And actually, Ghana really needs that, like, for people to sit there and then assess how the players they move
and everything
in certain angles that are prescribed and not prescribed, so that it will affect their performance later. I think that's
it's actually really helps a lot because for some footballers, like let's say as a biomechanist, you can tell like how which leg is actually stronger, what to actually easily. So like it's actually very much needed. So I did my research on that. And I was like, okay, I actually don't want to be on the field. The sun is not a nice thing. And then all of us were like, okay, I can do biomechanics. And then I saw that okay, shoes company actually always need biomechanics to know how. I was like, oh. Nike, and I was like, oh yeah, like it's actually a good field. And then being in sports, if I'm going on the field, you get to meet people, get to meet footballers, basketball, like connection, like exactly was more bigger than in a hospital you can work there as my research, but like you may not really get close to connections all the time, like depending on your but like if I'm into sports, there's no way I'm on the field, I'm not meeting Saka today. I'm not meeting
all right, so what do you have to say? I mean, I understand that you are in first year, right? You are probably now experiencing it more. You've not really met the tougher ones, but you give us an overview. Even with the I like the name,
sports management.
Just let's put that aside. What do you think about it as a whole?
First of all, I want to say the way Ami is enthused about what she's saying, she has passion for it.
I do have passion for it. How would like it?
So it starts from the passion. And you can't talk about Ghanaian youth and you just can't undermine their passion for sports.
Yes.
Not just football, but the sport. So I like the name, Physio and Sports Science.
Like I said, you liking the name, and then just give us an overview of sports management. What people often do not know. Is it just being a sports manager, or it goes beyond like you? I mean, on the field, trying to understand everybody's psychological or mental states before, like what's that? What's often don't we know that people know?
As I said, the name is Sports Science. So you sitting back and watching the game is different from what we are doing. We are watching the science behind what you see.
Okay.
Yes. So what goes into the things you are seeing? For her, she has specialized in one aspect, which is the sports therapy.
Okay.
As part of the management, the therapy sessions, the players, the biomechanics, their health, their nutrition, what they eat before playing games and all of that. It goes into it. We also learn it. Now from there, we look at every other thing.
Like the general overview.
The general thing.
Observing like behind the scenes.
You know it.
Of
course. Every other thing in the game of sports, everything from the organization of the game, the event itself, the security of the stadium, the state of our stadium, everything related.
Yeah.
And you see, I don't know, like how many universities are doing sports management.
I don't think it was.
I don't know.
I think for now, K University is the only place I know is offering sports management. And of course,
it's really good. But I remember the person that spoke to us during our whole talk when we were about to pick our options, and he had really made it big in sports management. I was even considering the sports management at that point.
If you have a sports manager, you can actually identify every aspect of them.
Every aspect.
The science behind their movement, their intellect, everything that goes on at the field, and we improve performance. That's one day Ghana will win the World Cup. In fact, Ghana will be the most.
That is it.
Okay, so can you give us an overview of physiotherapy?
So when we talk about physiotherapy, we are more into rehabilitation of individuals, and we usually work in the hospitals, though sometimes we may go for locum. It's an important source of money. Locum is very, very important. But in the hospital settings, usually physios, we have our department. We operate on, let me say, OPD base. The patients can come from outside. If they've heard of us, they come directly to us. We assess them, then we take care of them. If that's not so, then when they go to see the doctor in the consulting room, the doctor sees that they need physiotherapy, they are referred. But there are some times where the patients cannot move, so we have to go for ward rounds. That's the most interesting aspect of physiotherapy, in the sense that we touch every aspect of the hospital. We go from pediatrics to gynecology, even to the extent of sometimes you may even be going to the mortuary, but it's not that often. But everywhere we are there. So,
Mortuary.
What
What are you going to do there?
oh, maybe you want to. The person had a, let me say, a gory accident, and the body like it's not well positioned. You can't like bury somebody looking like that.
Okay.
So you can come in and reduce whatever dislocation that has occurred. You see, we don't always go there, but a physiotherapist can go there. Physios, we go everywhere in the department. So you go for your ward rounds. There are bend cases, like fracture, any sort of thing. Physios are there. Then with the locum, you can go. People with
Of course.
CDA, you go there to their homes, you take care of them, then you collect some coins.
Yeah. It's for
Even averagely, what some NSS people take is like 150 cedis, and then most PTs are here they take like 300 cedis.
Oh, of course.
Yeah, per like 2
After all
hours.
the stuff I've gone through in this department, there I will charge you.
Some even more. They have more than 3 patients, and they are
After all
taking care
the
of.
tears you've cried, after all the panic attacks to check your CWA, oh dear, now I'll charge you.
If you don't charge them much, they will not
Respect it, that they'll think it's
And
just
in fact, what we do actually speaks for it,
Yeah.
because we don't just come and then order you to do something. It's like we do it together with
you, yeah.
Uh-huh. Yes, and then one thing is that even sometimes before people go for surgery, sometimes the doctors consult the physiotherapist, like a child with clubfoot. You
Yeah.
get it. Sometimes they consult the physiotherapist to know whether it will be ideal for
Ideal
the
for
person
them
to
to
have
do.
the tenotomy, or probably the rehabilitation is enough for the child or even the adult. Yes, yes. So we go beyond just sitting at the department and then taking care of people. We touch every aspect of the hospitals and even come to the field. Sometimes we work hand in hand with the
With the
sports
sports therapy.
managers and then the
Sports
sports
therapy.
therapists. So it's like MDT, multidisciplinary.
But I
We
think
all
people
work
also have
together.
this misconception about physiotherapy that like if you let's say you go for a surgery or something and then you have to rehabilitate yourself back, people believe that they don't need a physiotherapy. Like you can easily go online or like you already know what it is to like get back on your feet. So they don't see
When
the
they
point
go
of like
online,
actually going to a
I doubt
physiotherapist.
I doubt probably they've had let me say, how do I even put it? They've had surgery. Let me say I went to the hospital and I had CS
Yeah.
because of one or two reasons. I had to do CS and then they've discharged me. They cut through your muscles and
Yeah.
now your muscles probably may have weakened, or you see when they cut it like that, probably they interfere with the nerves that innervate the muscle. So you need to rehabilitate yourself. Do they tell when they are searching, do they search with the muscles that
Of
have
course,
been
I'm not sure
affected
they do, but they
and the
just
kind of
believe that because
rehabilitation
a
that they have to
physiotherapist
do?
will come down and tell you, oh, do this to stand, oh, do this to this. So they believe that why am I paying you that kind of a thing? Like it's something I can do on my own or something like that. They don't see that it's deeper
You
than
can't
that.
just sit in the house because
Exactly.
we do assessments.
Prolapse. Oh, it's very interesting where you do the Kegel exercises. Then you use the biofeedback.
Yes,
Then
and all
you
of
try to input like the electrical stimulations to stimulate muscles. It's very nice. Bell's palsy, facial palsy. Like the conditions are numerous.
And sit in the comfort of
of
their
their
homes
homes
and
and
even
just
do herbal.
Hey,
Do
no.
you know I heard of this case that really saddened my heart? The person had stroke, right? And then with this herbal treatment, pepper bath was part of the treatment. So they put the person under the sun. And then I don't know what the pepper was going to do, whether it will bring back the muscles back to life, or the person sat under the sun and had the pepper bath.
Oh.
And I learned after some time the person died. I mean, people should really learn
too
much
much
about
about
these
it.
things. It's not when it happens, even when you get the TI, we'll be talking about CVA soon. People think immediately you get stroke, you need to take it to the
Like
herbal.
people just are quick to like herbal online. Like they believe they know, like, but there's a reason people go to school to actually study this because they have more
And
information
most
than
of
you.
these herbal treatment, they just apply some medication, these herbs, and then they just leave you. They don't even. You see, someone will come with contractures like this, and physios, when you come with such contractures, please, we are telling you, we can't do anything about it. Stroke with contractures that have set in. Oh, some
True.
therapists may probably try to feel your pain and say, oh, ebeko, ebeko, but naturally, we can't do
Do
anything for them.
anything.
All right, so please, we'll be talking about CVA. Would delve much into what CVA is, some of the courses, clinical presentations, and then what our role is as
Therapy.
physiotherapists or exercise
So
and
and
sport
sports
therapists
therapy.
and sports managers. I don't know. I don't want to leave you out, but it
But
will be a conversation, it will be a learning platform for all of us. And then we'll
yeah,
also discuss anything that we have also.
yeah.
So, Agulesu, please start with us. CVA.
CVA standing for cerebrovascular accident, commonly known as stroke, usually affects, let me see, the older generation. But there are instances where children with sickle cell can get CVA. Well, CVA usually affects, let me say, half side of the body. There be hemiparesis or hemiplegia. It occurs to any time. Can affect any part of the body. Then sometimes, if it's very severe, you may have a facial palsy. It's not always that you get a facial palsy. Some people may experience so much pain with it. Some people may not experience pain. Some people may, let's say, feel dizzy and things. Some people cannot even talk.
Yeah.
They become aphasic. You're talking to them, they don't understand when they are not oriented in time and space. Then I think some of the risk factors to the CVA is when you have a family history of CVA, you should be very, very careful. Once somebody in your family has gotten CVA before, you should go for regular checkups. There's, yeah,
Be your
there's
lifestyle.
some of these things can be stopped in time. If you usually go for checkup and they see that you have a consistent, let me say, high blood pressure, it's you can't take someone's blood pressure today and decide if the person has a high blood pressure. It has to be consistent over several days, several periods. Then can confirm that, oh, you have this, and you start managing it. It's better for you to go for checkups and you see these things. Another risk factor is let me say obesity. You have to check your weight. Basically, with CVA, you have to be very, very careful about your lifestyle. CVA usually comes with the lifestyle, then maybe your family history will come in. Those are basically the basis of it. Now, if you want to talk about the mechanisms of CVA, where we are, let's say there are about two main types of CVA, but you can see there are three. We have the hemorrhagic CVA, we have the ischemic CVA, and the transient. The hemorrhagic one comes with a ruptured blood vessel in the brain. CVA comes about when blood supply to the brain is like not enough. So no matter what happens and blood refuses to get to the brain, your brain is so much complicated that within a few minutes of, let me say, no blood supply, it begins to die off. And God, being in His infinite wisdom, created a brain such that as we are all living here, we are using very small portions of our brain. So we are sitting here, we are controlling all parts of our body. It's not all of our brain that is doing that. So if one part of the brain dies, or let's say a portion of the brain dies, the other one can come in and support. So that's how CVA works. So when there is a rupture in a blood vessel supplying a part of the brain, that part begins to die. Then if it's not stopped in time, it goes completely. That is the hemorrhagic rupture. With the ischemic, maybe caused by embolism of a thrombus. And when we say a thrombus, it's a blood clot within, let me say, a perfectly fine blood vessel. So usually, even with people with deep vein thrombosis, we don't like to move their legs. If you start moving it, the embolus will go and dislodge in the brain. That is what causes the ischemic stroke. Now, with the transient one, we can't. Some people may attribute it to it being ischemic, in the sense that maybe it was blocked for a while and it was free. But if you get transient, when we talk about transient, it's when you get let me say, the symptoms of stroke within a short period of time, you are okay. Some people, yeah, some people won't take it serious, but I would say that's kind of the deadly one because it just comes into your mouth. So you should be very careful and take care of yourself. Yeah, it warns you that
It's a warning.
yeah. Oh, sorry. Yeah. It warns you that you are likely to suffer CVA. Then I think there are, let me see, about 5 letters. It's called Be Fast to catch the symptoms of stroke.
Be fast.
Be fast, yes. You check for balance in the person. If the person cannot, stand. So you meet somebody, you are with someone, and the person is complaining, and the person has a, yes, you think it is stroke. To confirm it is Be Fast. You look for balance in the person. Can the person balance himself very well? You look at the person's eye. Is he feeling dizzy or something? Then look at the person's face. Like we said, the facial palsy. Maybe one side has dropped.
Okay.
Then the arms. Can the person move the arm? Or when you take the person and the person just drops like that. Then the S, I think, is sensational. Am I wrong? Be fast.
I
Um,
just had it in mind, right? So the face, the arm, the speech.
yeah, thank you. Speech, aphasia. Can a person talk back to you? Sometimes I think is it the left side of the brain when it's affected, it affects speech. Usually, I think so. It's not always that when you get stroke you cannot talk, but when the part of that recognizes speech is affected, you cannot talk. The,
What about remembrance? Because some people go from speaking English like during their youthful days and everything to when they get stroke, they only speak the local dialect or something like they can't really go back to understanding English or speaking English.
You see, one thing about stroke is, you see, how the brain is structured. We may say the left part, if it's affected, let me say, when the front part is affected, when it comes to the intellect and all of that, we have it here. So if um normally people say, okay, the frontal side, if it's affected, then probably the person doesn't have it. But when you go into the various parts of the brain itself, you have the prefrontal, all those things. It's like there are sections that actually control specific things.
Things.
So you can't just say, okay, probably, like we always say, if this side is affected, then it's this side. But we have specific places on the brain that control, in fact, specific things. You get it? So most of the times, for education's sake, we are not going to explain to the person the types and the various places in the brain that actually it will be overwhelming for the person. Normally we just, I mean,
Summarize it up.
summarize everything and then break it down like that. And then we as clinicians, we play a crucial role in the rehabilitation of stroke.
So
I mean,
with the rehabilitation, the three types you mentioned, do they have like different ways of handling them, or you handle all strokes the same, the hemorrhagic and all of that? Like, do you handle
they
them?
all have clinical presentations.
handle them the same way. Each individual comes with their own presentation. So though there could be a common, let me say, symptoms amongst them, you should assess the individual to see what the individual is lacking for you to correct it. It's not just that the person comes, so this is my facility, CBA, you are just doing, let me say, standing re-education, walking re-education, sit to stand. No, you should assess the individual and look for what the person is lacking. Why did the person come to you? You can even get some of your treatment from what the person wants. So the patient tells you what he wants to do, then you work. Yes.
With CDA cases, like we always say, even we always tailor our needs to the patient. We tailor our treatment to the patient's needs. So if the patient come with the ischemic, mostly people say hemorrhagic is more serious than ischemic, and ischemic is the most common one. People come with ischemic and they may have the partial weakness or the full, like, do you get it? So with that one, if the patient is present, it is what the patient is present. So if the patient comes with like nothing, like there's nothing here, you should know that Now you are now coming to
Come
make
to
sure you
everything
are
is back.
stimulating the muscles before when the
Anything.
person has some strength, you get it. They know that you have to maintain range of motion
Motion.
to allow free movement before contractures set in. You have to improve the strength and then all of that. So what the patient wants is
Want
what
and what
you
you
actually
have
do.
to do.
Some people come with balance issues, some come with gait problems. Most of the times we see the gait
Gate
problems and
problems, yes.
sometimes we see the balance issues. So you have to tailor everything to the patient's needs. Like we, the therapists, we have like standard things we actually do. Okay, if it is muscle strengthening, I know what to do for
For
muscle
muscle
strengthening.
strengthening.
But there's nothing like, okay, for muscle strength, this is the only thing you
Only
have to
exercise
do
you have to
for
do.
you get it. There are lots of things you can improvise. And even some people come to the hospitals and probably they will tell you that okay, they can't lift this thing up. But if you give them a comb, this is called task specific training. If you
Training.
give them a comb, okay, try and comb, you force and comb, you see that the person will be able
Go
to
to, yes.
comb the hair. Do you get it? But when you tell the person to raise something
Or
upwards,
the
be like,
person.
I can't do it. So that is when we also bring the task specific training. You give them things around them, things like everyday things that they do that will actually help them to improve. So physio is not just you treating the patient at the hospital, but also encourage them to also transcend that into their various home by also speaking to their caregivers. That is why in the assessment we ask with their social history, who do you stay with?
With and yes,
Uh-huh.
but they play a huge role too with
Do you
them.
get it?
Yes, true.
So that we know how your environment, even it's ideal for us to go to their homes and see how their home
Homes.
setting is and also tailor our treatment to them. But it's like we don't do it most of the time because it's ideal for us to go to the patient room,
To
see
see,
their
yes.
setting, and
True.
also see what we can do best with what they
That when
have.
they are home too, how should they be
Do you
living
get
and
it?
all of that to help to improve
Someone
it. Yes.
probably in the house, their tiles is very smooth. When they are even going to the bathroom, their bathroom tiles very
Very
smooth.
smooth.
Do you get it?
Yeah.
There are lots of things that you can.
You can come
So
back
it's
to,
ideal for
sure.
us to also tailor our treatment based on their setting in the house and also how we also see them at the hospital too.
Because at the end of the day, most of them who come to you every day for treatment are not with you 2 person. When they go home and then they're just on the bed, let's say they come to you twice a week, remaining 5 days they're just on the bed, like
They
you won't
don't
really
do
see
anything. You
much
get it.
improvement as you're going to do. So you have
So
to
you also draw a plan for them in the house. And I'm doing a research about stroke patients, right? There's a comparative analysis of quality of life of those doing the hospital rehab alone and those doing the hospital
hospital
and
and
home
home.
rehab. And mostly in the Ghanaian setting, those who are able to afford the locum are those who are a bit well to do. Let me put it
Yes.
that way. So it's like in the stroke management, those who do the home and then the hospital, they have better outcomes. To
I
me,
don't
that's
feel in the
you
hospital
get
too
it.
it's to be shared, because I feel like those that go to government hospitals, you're not really allocated so much time because it's a government hospital. There are lots of people that are going to
And
come in for
the
physio.
therapists in
20
the
minutes
system too,
there,
there are
like
not many.
they are trying to rush you, and then
There are some government hospitals now that I think very, very
a lot. I'm not saying that government hospitals don't do very well, but like let's say in a government hospital you can see like 50
A lot
people
of people
coming.
come
But when
there.
it comes to a private, because I did my last internship in a private hospital, and then the one I did in my first year, I did it in a government. So I could differentiate. In a government hospital, there were a lot of people coming. You will barely have time. You
And
have to rush through treatment.
their
But in the
attention.
private hospital, like you are allocated 1 hour, 1 hour, like you book an appointment, and then I know I have the whole hour for you, and then like I can go in there. But in the government hospital, there, if you are spending 1 hour there, you are thinking of the next 49 people you have to
It's true.
see. Like
It's true.
you're going to
And with
rush
stroke
through
patients
treatment.
too, like it really takes
Exactly,
a
it's
lot
a
of
whole
time.
lot
And
to
now
do.
too, stroke is one of the leading cause of disabilities now. So we have a lot of stroke patients coming to the hospital, and it's like the attention that they need for them is not really there.
Yeah.
So introducing something like the locum, like I want it to be a situation where the healthcare system will establish that as in
Sure.
people will come to the house.
How
So as you are doing the hospital, so it's like more or less like community physiotherapy. Because when you go outside, we have community physiotherapists.
physiotherapy.
So
Yeah.
they don't work in the hospitals. They work in the communities. So when you start the hospital for like I think a month or so, you go to the community physiotherapists for them to continue because they are closer to
To
you.
you, yeah, which is
So
way
they
better.
continue the home one for you. So I feel if we establish that here, we can actually manage
Manage a lot. But I feel
the
like most people to come and
and
like
they
they are
should
not seeing improvement.
employ
But
a
like
lot of therapists.
therapists, because it's
Employ
really much
a lot
because
of
at the end of the day,
therapists.
you're coming, you're complaining, you're not
Uh-huh.
seeing improvement.
And
But the
those
hospital there as a physiotherapist, I'm thinking that I have 49 more people to see. I can't really
so
be
even if
on
the
your
attention
case
is
giddy
not
giddy,
there
like
at the community level, they can also
to
give
go
that
back and
attention because
everything.
it's closer to you and then everything.
Because
And then
coming
please, we are urging the government, please employ
employ more
therapists.
physiotherapists.
Stop traveling outside.
Yeah.
We need you here.
Pay them well too, so that they can stay back.
And then we encourage people who may watch this, you come across this video. If you don't know what to do, physiotherapy and sports sciences is a very big avenue for you to explore a lot of things in the healthcare system. We like, in fact, we've
It's
said a lot.
lovely. You enjoy it. I promise
Do
you.
musculoskeletal, those who
At
do
least
neuro
brought to.
rehabilitation, those who do pediatric physiotherapy, like
I think that is
yeah.
like when people think of branch, they don't believe that we physiotherapists we can branch and like specialize in something. They only think like maybe it's medicine. As a medical student, you can say that, oh, I want to focus on gynecology. I want to focus. They don't know that physiotherapy you can actually specialize in what you want
Yes,
to
and
do.
please,
And
if you want to be a doctor, if you medical school is the only place you can be a doctor.
like
Because when you go to India and then Nigeria, they do the full system.
Yeah.
When you finish, you are doctor of physiotherapy.
Yes.
It's just that it's quite unfortunate you do just 4 years, but you can still
with time
further
we'll
the
get
2 years
there.
and
Yeah.
then be a doctor of physiotherapy. So yeah, you were saying something.
Well, we have to also know that even if you are physically active, you can still get a CVA, and it's not always that is a hypertension that can cause CVA. Sometimes when your blood pressure is low, you can also get CVA. So we shouldn't undermine that fact. There are several risk factors or several causes of CVA, but don't just be too quick to assume or be too quick to neglect something. All of them matters. So once somebody is there, the person may be physically active, the person has fallen there and shown signs of a stroke. Be careful with how you handle the person. Then you see if it's transient or not. If it's transient, the person has to be very, very careful because it will come back in the future. The likelihood of it coming back is very, very high. And when it comes, it's very serious. And there have been cases where people may even have, let me say, ischemic or hemorrhagic stroke and they get a relapse. All of it are important, and I think we shouldn't defer our treatment. Once you are going for treatment, take them seriously. One thing I've noticed with some of the patients in Ghana is that they may start the rehabilitation, then maybe due to some things they stop. Even if you are not able to come to the hospital, you learn some things at the hospital, things you can do them at home. You see, they will defer for over a year or something.
They were not
They were
saying
not
it.
saying. I mean, that's also very big on we physiotherapists part when we're giving exercises sometimes. And they exercises so that they can go home and then they will do without you being there or without the equipment being there.
Yeah, so I think all of these are very, very important.
I'm learning. I'm learning. Yeah, sports
We have
manager.
our sports
Now
manager.
I know some of my
That is
athletes
not
can get
exactly.
CBA.
You're
Yeah.
just on the field and then you see
Yeah.
something happen and then
Something
you are there. You
happened.
can.
Those who die on the field is the fault of the sports managers.
They didn't catch it.
Yeah.
I think when you see somebody else collapse, you just make sure you've like released tight clothes, make sure the person can breathe. See somebody falls, I try in Ghana, somebody falls down. Everybody wants to see they are around the
Yeah,
person.
Exactly. Space to actually get ventilation.
Yeah, I think it would be good for us to, indulge more of these first aid courses to even non-educated people.
That's one thing I think has been an idea that I would actually want to pioneer. But the fact that first aid should be taught as a compulsory course, not
Because
just
you
for
don't know
students,
really.
but it's like you see that awareness creation they make on
Yes.
television and all of those things. I feel it's like it should be mandatory for everyone, each and everyone to know about first aid, even to the market women, to the
Everyone,
illiterate, to uneducated
We are
ones.
everything like.
And it should be mandatory for we students here. And
The world needs the
But it's true
therapist.
because you never know what just happens at a situation, or that you don't know what to do to the person
I
beside
went
you.
through
Yeah.
the same situation. You see, after the Pasa games at Pajo, I did it because I was too tired to find something to eat. I woke up around 12. I had this terrible headache. And I was like, okay, I'll be finding something to eat in a few minutes. So let me just take paracetamol and then find something to eat like in the next few minutes. So when I went out to get some food, I passed out. Like I was just buying the thing, and before I realized I was on the phone. And I was there for some time where I was buying the food. Someone told me the woman was shouting, I was there. At that moment, too,
Eh?
I lay there, I think they said I lay there for almost 5 minutes. When I came back to my senses, I just woke up from there because I didn't know what happened. I thought I was probably in the room.
Room or something.
I don't know. For some reason, I thought I was in the room. And then I got up and then went straight heading to my hostel bag. So I was like, so this woman didn't know anything about. It was someone that came to grab me. I was like, did you realize what is going on here? Do you know what happened to me? It was then I was like, so something really happened to me. And when I was buying the food, the woman didn't think of any person. In fact, nothing came into the head apart from me being there.
And them just shouting.
Whoa.
That was the only. I also asked myself, so what happened to this? You people, your idea of pouring water on the person.
Yeah.
Maybe that one you didn't do. You went away shouting and was there. So what if, in fact, that moment she said, I didn't wake up at that particular time. I didn't get back my consciousness at that particular time. They would have declared me
You did, I just carried it.
Just carried you away.
send me to the mortuary.
Yeah.
And what if at that time to all conscious and they put me in the fridge and that one establishes my death?
Officially.
It shows how there is actually a gap when it comes to this
Of course.
There
education
needs
of
to be
first
awareness
aid.
of this.
Yes, and we health students, I feel we should, the school should take it up as something like, especially we the health students, we should take up mandatory courses from first aid so that we can actually spread it more to the other colleges and then make it a national subject. So we'll be wrapping up very soon. If you have any advice, anything like your last words, your social media handles, if you're into any business that you want to market,
I don't have any business.
your social media.
Hey,
Social media.
Madam Nike, Adidas.
Put myself either. Who knows? Nike might want to come in for an internship or something. Please, my Instagram handle is Amy_ND, AMMIE_ND. I think that's my handle for every single platform of social media. You'll find me on Amy_ND. Thank you. Nike, please come in for an internship.
What's your advice before on EST?
On EVA. I would actually advise that before you pick a course, don't just go with what society wants. Make your own research and have your own passion. Because I have this big idea of there's no how you be passionate about something and you can't make money out of it, or you can't be successful because you have passion. So it's going to drive you to actually like venture into it properly and know what to do. So yeah.
All right. So yes, any advice, your social media handle, any business you are into?
Oh, my socials, my personal socials is at the new Capello.
This Capello thing.
At the new Capello.
The
New.
new Capello.
The new Capello.
Who is the old one?
Oh, the old one is there. It's 75 years now. Yeah.
Oh, okay,
Yeah.
okay.
So I'm the new Capello. And then I also have my brand, the Soccer GPT. It's a channel.
Where on
All
WhatsApp?
social media,
All
but it's
social-
active on WhatsApp.
Oh,
So
okay.
you
You can follow him.
just follow now, almost at 1K now. Yeah, and then for sports managers,
Almost 1K this year.
Oh, just started. Oh. You see, as you are aiming for Nike.
Yes, I'm aiming there.
Ah.
Please call me for an internship. I'm ready.
Yeah. So sports managers, as you are coming in, be prepared. It's not just about what you see outside. You are rather going to learn what is inside and how it is done. That's what I can tell you. From everything to everything. You learn everything to everything.
To everything. We like that. Okay, so Mr. Kim.
That's why maybe a part of the Gen Z.
Very bad at
Social media. Hey, in this era, you can't call yourself a Gen Z.
Like you have
and
to
not
put
have
yourself
social media.
idea. Even on
That's
LinkedIn, you can find me, my full name on LinkedIn. I'm there.
I'm still working on it. I just have the account just view others. So right now I can't
To
do
view
that.
others.
when I
Alright.
work on it,
A Gen Z without
That's a
access to
handle.
social media. We should
Shako, Shako. That's really Shako.
but, with the courses, if you want, sorry, the options, if you want to choose it, like Amy said, know the why. Why do I want to do this? What job opportunities can I get with this? Don't let other people influence you. At the end of the day, it is you and the job. You may be
Sure.
good at the job, perform brilliant, like you are brilliant, you can do it. But what happens if there is no passion? Passion is really needed in everything. Like our friend here, the name, physiotherapy, just he was
It was so
involved. So if you have the passion, if the passion is there, I think you can succeed in any field you choose.
Yeah.
All right. That being said, I think we've come to the end of this PASA podcast. In fact, we've laughed. I should talk. Hey, somebody
Yes.
say I should talk. Okay, okay.
Yes, please.
All right. My socials. I'm Jess Padilla. Find me everywhere, Jess Padilla, on all social media handles. But my LinkedIn is Nana Owusu Jessica. You can find me there, and I also sell tote bags. Please, very nice, affordable tote bags. Every type you want. It's very affordable. Yeah, I'm emphasizing on that. Since we've come to this,
Share your LinkedIn.
Yeah, I didn't share my LinkedIn. Please, my LinkedIn name is Amarachi Undupu. AMARACHINDUPU. Thank you. God
the
bless you.
LinkedIn there is very
It's very much
professional.
important. We're looking for jobs out here, remote jobs, physical jobs, internships that will make us travel, and
We need
we need it. Oh no, like exposure.
And
I
then
need
come
to
back.
see things from different
Yes.
parts of the world to have an idea
And come back.
about it. Oh no, you need to travel to explore. So when I'm speaking about it, I'm speaking about it based on experience, so
Yes.
based on what I can, not just knowledge. I need I'll come back.
Yeah,
I
she
will
will
come back.
She will come back.
I'm still African. I'm still Nigerian to an heart. I'll come back. Oh, I'll come back. Minister of Sports. I'm back.
All right, so we've come to the end of the PASA podcast. We've laughed, we've learned, we've reflected on the journey from first year and then the crucial role we play as health professionals. And if you are in physiotherapy, sports science, sports management, know that you belong here and your path really matters. And please don't forget to share this podcast to all your friends and your loved ones. Please don't forget, because we are just getting started. So keep striving, keep striving, keep growing, and then keep showing up. Please don't forget to like, subscribe, and share to all your friends. Thank you very much.
Subscribe,
for
and
tuning
share.
in. We
Thank
love
you
you so much.
And